You've just been told your blood pressure is high, and you walked out of that appointment with a prescription, a vague warning, and no real idea what to do next. This is for you. Because yes, medication can help, and sometimes it is necessary, but there are also things you can do in your everyday life that can move that top number and that bottom number in the right direction, often more than expected. I'm Dr. Charles Oliver, and as a cardiologist, I see every week how quietly high blood pressure damages the heart, brain, and kidneys. So subscribe, share this with someone you care about, and let's make this simple and practical. Step 1. Change the food pattern, not just one ingredient. In clinic, I can usually tell within a minute whether somebody has been given useful lifestyle advice or whether they have just been told, eat better, which, to be honest, is almost useless. What I tell my own patients, and honestly what I remind myself of after weeks, is that blood pressure responds best when you change the whole pattern of eating, not when you obsess over one superfood. Your arteries are a bit like garden hoses. If the hose walls stiffen and the fluid volume rises, pressure goes up. Foods rich in potassium, fiber, calcium, and natural plant compounds help the vessel wall relax, while highly processed foods push things in the opposite direction. That is why the DASH eating pattern still matters so much. Back in 1997, the original DASH trial, published in the New England Journal of Medicine, enrolled 459 adults and showed that a diet built around fruits, vegetables, and low-fat dairy lowered blood pressure in just a few weeks, even before people focused hard on weight loss. Then the DASH sodium trial in 2001 showed something even more useful. When that same eating pattern got paired with lower sodium, blood pressure fell further, and the effect was especially strong in people who already had hypertension. That combination is not trendy. It is not glamorous, but it works, which, if you think about it, is actually quite remarkable. So what does that look like tomorrow morning? It means your plate starts looking boringly sensible in the best possible way. Half vegetables, a source of protein, beans, or lentils a few times a week, unsalted nuts in sensible portions, fruit you can actually see and grab, yogurt instead of dessert more often than not, and fewer meals that come out of crinkly packets. A lot of you will be wondering, do I have to become perfect overnight? No, absolutely not. Start with one meal a day. Build one blood pressure-friendly breakfast or one blood pressure-friendly dinner and repeat it until it becomes automatic. Now, here's something that surprised me when I first started talking patients through this more carefully. Once people stop chasing miracle foods and start repeating a simple meal structure, they usually feel less deprived, not more. Why? Because their day gets easier. There is less decision fatigue. And here's the thing. Consistency beats intensity almost every single time. If you want one practical tip, do this. Before bed tonight, decide exactly what your first meal tomorrow will be, and make sure it includes one fruit, one high-fiber food, and one minimally processed protein. That one decision can change the tone of the entire day. And let me make that even more concrete. A breakfast could be plain yogurt, oats, berries, and a handful of nuts. Lunch could be beans, chopped vegetables, olive oil, and some grilled chicken or fish. Dinner could be salmon, potatoes, and a large tray of roasted vegetables. None of that is exotic. None of it needs a supplement aisle. It is ordinary food arranged in a smarter pattern, and ordinary repeated is what changes a blood pressure chart. Right then, let's go to the next step, because this is where many people unknowingly undo all the good work. Step 2, get serious about sodium, especially the hidden kind. I rarely see people pouring mountains of salt onto home-cooked vegetables anymore. What I do see all the time is people saying, I hardly use salt, while eating bread, sauces, soups, deli meats, ready meals, takeaways, and snack foods that quietly load sodium into every corner of the day. So when I talk about cutting salt, I'm not really talking about the salt cellar first. I'm talking about the invisible salt already built into packaged food. Think of sodium like a sponge for water. When you carry more sodium, your body tends to hold onto more fluid. More fluid in the circulation means more volume pushing against the artery walls, like turning up the water flow inside that same hose. On top of that, higher sodium intake can make blood vessels less flexible, so the pressure problem becomes both extra fluid and tighter pipes. Stay with me because this matters, because a lot of people assume salt only matters if their numbers are extremely high. It matters long before that. The 2001 DASH sodium trial is still one of the clearest demonstrations we have. It randomly assigned 412 participants to either a typical American diet or the DASH pattern, and then changed the sodium level within those diets. Compared with the control diet at high sodium, the DASH diet at low sodium lowered systolic blood pressure by 7.1 mmHg in people without hypertension and by 11.5 mmHg in people with hypertension. That is a big shift from food alone. I'm not going to overstate the evidence here and pretend everyone gets the exact same result, because they do not. But the direction of effect is solid and clinically meaningful. So how do you use that in normal life? Read labels, but only on the foods you buy most often. Don't turn grocery shopping into an exam. Pick your bread, soup, sauce, cereal, and ready meals, and compare sodium across just those items. Swap one high sodium version for a lower sodium version and keep moving. Rinse canned beans. Choose unsalted nuts. Ask for sauces on the side. And if you eat out a lot, save restaurant food for a few meals a week rather than making it your default. You know what works surprisingly well? Cooking double portions and keeping one backup meal in the fridge, because convenience often beats intention. Okay, so once food starts improving, the next lever is movement, and this one is more powerful than many people realize. Step 3. Make your muscles help your arteries. One thing I notice in patients with beautifully controlled blood pressure is that they often do not think of exercise as a heroic event. They think of it as something as ordinary as brushing their teeth. A walk after dinner, a few resistance exercises in the morning, stairs instead of the lift when time allows. To be honest, that mindset matters, because if you make movement feel dramatic, you are less likely to repeat it. Why does exercise lower blood pressure? Because every time your muscles contract, they pull sugar out of the bloodstream, improve insulin sensitivity, and send signals that help blood vessels open more easily. The inner lining of your arteries, the endothelium, starts behaving better. Your nervous system also becomes a bit less trigger-happy, so you are not living in constant mild overdrive. The simplest analogy is traffic. When your circulation and metabolism work well, traffic flows. When they do not, everything backs up, pressure rises, and the system gets noisy. There was a large 2023 network meta-analysis in the British Journal of Sports Medicine that pooled 270 randomized controlled trials with 15,827 participants. It found that aerobic training, resistance training, combined training, high-intensity intervals, and isometric exercise all reduced resting blood pressure. In other words, you do not need the perfect exercise. You need a repeatable one. That is genuinely liberating for people who think they must join a gym, buy equipment, or become a different personality before they start. Some people like structure, so here is an easy weekly target. Aim for at least 150 minutes of moderate movement across the week, then treat anything extra as a bonus. If the gym is not your thing, fine. Brisk walking counts. Cycling counts. Dancing in your kitchen counts if you actually break a sweat. And yes, those short bouts during the day matter more than people think, because they interrupt long stretches of sitting that keep the body sluggish. And if you're finding this useful, which I really hope you are, then please do hit the like button, subscribe to the channel, and share this video with someone who needs it. It genuinely helps these videos reach more people, and that matters to me because high blood pressure is common, quiet, and far too often ignored. My practical advice is very simple. Start with a 10-minute walk after one meal every day this week. Not an hour, 10 minutes. Then add 2 short strength sessions each week using bodyweight or dumbbells. Sit to stand from a chair, wall push-ups, rows, squats to a box. A lot of you will be wondering whether walking really counts. Yes, it does. Honestly, the best blood pressure routine is the one your body sees again tomorrow. And this next one is probably the most overlooked, because people often know it matters, but do not realize how little change can still help. Step 4. Lose a little weight, especially around the waist. I know this topic can feel loaded, and I want to be careful with it. This is not about shame. It is not about chasing some perfect body. It is about mechanical and hormonal load on the cardiovascular system. When people carry more weight, especially around the abdomen, the body often produces more insulin, more inflammatory signals, and more sympathetic nervous system activity. The kidneys also handle sodium differently, so the heart ends up pushing against a system that is already primed for higher pressure. I often explain it like carrying a backpack you never take off. Your heart can do it. Your arteries can tolerate it for a while. But day after day, year after year, the strain adds up. And here's the thing. You usually do not need dramatic weight loss to see blood pressure start to move. In a hypertension meta-analysis by Niter and colleagues, even modest weight reduction lowered blood pressure, and an earlier estimate cited in that paper suggested roughly 2.4 mmHg systolic and 1.5 mmHg diastolic improvement per kilogram of weight loss in trial data. Again, not magic, not instant, but real. Now, I'm not going to sit here and tell you this is a magic bullet. It isn't. Some dramatic claims online run way ahead of what the research actually supports. Weight loss does not fix every case of hypertension, and some lean people absolutely have high blood pressure because of genetics, age, kidney issues, sleep apnea, stress physiology, or a combination of factors. But if you are carrying excess weight, even losing 5 to 10% can make a meaningful difference. That is the honest caveat moment this conversation needs. I also want to say something about the waistline specifically. Visceral fat, the fat packed around abdominal organs, behaves differently from the fat you can pinch. It is metabolically active. It sends out signals that nudge the body toward insulin resistance, inflammation, and higher vascular tone. So if your belt has been getting tighter, that is not only a cosmetic issue, it can be a blood pressure issue. The useful question is not, how fast can I lose weight? It is, what could I still be doing 3 months from now? So do not start with punishment. Start with friction removal, protein and fiber at the first meal. No liquid calories Monday to Friday. 1 plate for dinner, not 2. Walk after the meal most likely to turn into sitting. Put the snacks out of sight, because environment beats willpower more often than people admit. You know, sometimes the most effective plan sounds almost too simple, but simple is exactly why it works. Moving on, let's talk about the step that many people dismiss as soft or optional, when in fact it affects the pressure system all night long. Step 5. Protect your sleep like it is part of treatment, because it is. When I ask people with stubborn blood pressure what their sleep is like, I often get a shrug. Not great, but that's normal. No, honestly, it is common, but that does not make it normal or harmless. If you sleep badly, too briefly, or at wildly different times every night, your body stays in a more activated state. Stress hormones rise. The nervous system remains more alert. Blood vessels do not relax the way they should. And if you snore heavily or stop breathing because of sleep apnea, blood pressure can stay elevated in a very persistent way. A 2026 systematic review and meta-analysis in European Heart Journal Open looked at behavioral sleep interventions in adults with poor sleep health and found average reductions of about 5.0 mmHg in systolic pressure and 2.9 mmHgs in diastolic pressure, with the biggest systolic reductions seen in people who already had stage 1 or stage 2 hypertension. I want to be precise here. The studies varied in quality and length, so I'm not going to overstate the evidence here. But the signal is strong enough that sleep should stop being treated as a luxury issue. There is also a rhythm piece to this. Healthy blood pressure is not only about the reading you get at noon in clinic. It should dip during sleep. When sleep becomes fragmented or breathing gets disrupted, that overnight recovery can fade, and the cardiovascular system loses one of its built-in reset periods. That is one reason poor sleep can feel frustrating. You can do many things right in the daytime and still feel as though the numbers resist you. So what can you do tonight, not someday? Pick one sleep time and one wake time that you can keep most days, even on weekends. Cut caffeine earlier than you think you need to. Put the phone away 30 minutes before bed. Keep the bedroom dark and cool. And if you snore, wake unrefreshed, get morning headaches, or your partner says you stop breathing, talk to your doctor about sleep apnea. A lot of you will be wondering whether better sleep can really lower blood pressure if diet and exercise are still imperfect. Yes, sometimes it can help more than expected, because poor sleep quietly sabotages the other habits as well. Now, if you take one idea away from this whole video, let it be this. High blood pressure does not usually come down because of one dramatic act. It comes down because you make the pressure system less stressed, less inflamed, less overloaded, and less volume heavy day after day. Better food. Less hidden sodium, more movement, a little weight loss where needed, better sleep. That is not flashy advice. I know that. But it is the kind that changes lives. And one final point before we finish. Please do not stop blood pressure medication on your own just because you start feeling motivated. Use these steps alongside proper monitoring and work with your clinician. Some of you will lower your numbers enough to reduce medication over time, and that is fantastic, but make those decisions with actual readings, not hope. Home blood pressure monitoring done properly can be incredibly useful here. Thank you for watching. I really hope this helped you feel less overwhelmed and more in control. If it did, please like the video, subscribe to the channel, and share it with someone who needs a calm, evidence-based explanation. I've also done other videos on blood pressure, heart health, and everyday longevity habits, so have a search around the channel if you want to go deeper. Take care of yourself, and I'll see you in the next one.